Bell's palsy or facial nerve paralysis. It is always unilateral paralysis of the facial muscles, that is on the one side. The patient cannot smile completely, cannot blink and elevate his or her eyebrows. There is difficulty in drinking and swallowing process. So there is drooping and the drooling. Moreover, the blinking of the eyes is also difficult one. The age of onset, it may appear at any age, but mostly near about or above 30 years age. It can be divided into acute and chronic stage. Acute stage, if managed, can be cured completely. About 80% of the cases can be restored towards normalcy by the immediate steps, preventive as well as curative ones. Mostly it is a viral disease, and in most cases it can be cured on its own by the preliminary or basic preventive measures and prophylactic steps. When it passes into a chronic stage, then it is a lifelong disease and it needs a prolonged treatment. So that produces a difficulty in the patient life. Now the diagnosis of the Bell's palsy. It is quite evident by the observation and the physical examination of the healthcare provider. Patient cannot smile, cannot whistle or blow his cheeks or mouth. There is drooling and dribbling, difficulty in drinking and eating process. So these are the evident symptoms. The most, that is the key symptom is that is the patient is unable to wrinkle his forehead muscles. It is a disease of, that is the weakness leading to the paralysis of the upper and lower facial muscle of one side. It is unilateral and he cannot. There is also complication in the ocular and the auditory system. There is facial pain, tingling and numbness, that is paresthesia, because the nerve, that is the seventh cranial nerve, is weakened due to the inflammatory and edematous compression, and there is disturbance in the conduction of the nerve impulses. In a acute stage, about 80% patient can be easily cured. Now next is, that is to perform the CT scan and MRI to exclude the other etiological factors, that is tumor, the fracture, other mass, or the pathology which is producing pressure and compression of the facial nerve trunk and its branches on one side. Now the management is, acute management is very simple. That is to alleviate the pain complaints. We use the NSAID drugs. Acetaminophen, ibuprofen, Proxen. These are the medicines which are used for the elimination of the facial pain, ocular pain, and the pain in the ear and the mastoid area. The main symptom is the drying of the mouth. There may be ulceration, loss of taste sensation, and drying of the cornea. So we produces use the tear glands and the lubricants drops for the lubrication of the cornea to avoid the abrasion of the cornea and disturbance in the normal vision process. It also produces an alarming damage to the optic nerve that produces the degeneration of the retina and the disturbance in the blindness. Disturbance in the vision leading to the blindness, partial or complete one. Accordingly, if it becomes chronic, then it is a very dangerous one and troublesome to the patient. We protect the photosensitivity by the use of goggles, sunglasses, and we can also use the nerve tonics, which are used in the routine use of drugs in the paralysis, nerve paralysis. That is the vitamin B complex, supplementation of the calcium and vitamin D in the various form, in the pills, in the injection forms. We can provide the normalcy or the health of the patient because vitamin B complex is a nerve tonic. So that is a compulsory one. Next is the corticosteroid in acute stage to retard the complaints and the pain and the inflammatory complication is the use of the steroid for few days. Prednisolone is preferred in the form of pills and also in the form of injection of dexamethasone can be given to the patient in the early stages to minimize or mitigate the complication of the acute inflammation to the seventh cranial nerve. So these are the medical treatment. Now, when the virulency of the infection is due to the viral infection or virus attack, then we can use the antiviral drugs, especially the acyclovir in the form of pills and also in the form of syrup and in the form of injection therapy that can be given in also in the chronic phase of the disease for a prolonged period. So immediately NSAID medicine. Then next is the physiotherapy. That is massage of the muscles of the face on one side or the affected side, especially the face forehead muscle, ocular muscles, and the muscle around the oral cavity on one side, affected side. When the disease has passed into the chronic stage, there is demyelination of the facial nerve, there is damage to the nerve, and that can be cured by the medical treatment. Then we passes or there is option for surgical intervention. So we can provide surgical procedure to decompress to remove the obstruction of the nerve pathway in the fallopian tunnel or tube. We remove the soft tissue and the edematous tissue or the growth which is blocking the impulse passage. So we wash the or clear the pathway of the facial nerve for its normal function and conduction of the impulses. Then next, when it is a complete paralysis of the facial nerve, then we also perform the nerve grafting. We get nerve from the other parts of the, especially sural nerve, and that part of the nerve is grafted in the damaged site. So these a process is rarely performed because this disease can be cured within in acute phase within 2 months by the physiotherapy, massage, and the medical treatment, neurotonics, I mean the drugs which activate, aggravate, and stimulate the nerve strength and health. So, Bell's palsy is initially an acute disease, unilateral. Mostly, it is, the damage to the seventh cranial nerve, that the facial. So, it is called as facial nerve paralysis or the Bell's palsy, and it is a curable one.